I'm Dr. Zoya of Trick1 Aesthetics and Skin Clinic. I'm a medical doctor with a specialty in dermatology, and today we're going to talk all about the amazing PRX-T33 peel. So what is a peel? So a peel traditionally is using some sort of hydroxy acid, so an alpha hydroxy acid, beta hydroxy acid. There's many different types, and they can be categorized into superficial, medium or deep peels, depending on how deep you need to go and how much the problem is on the surface of the skin. So this can be done for things like acne scarring, pigmentation, melasma, fine lines, wrinkles, quite deep sun damage, many things, stretch marks in other areas. It can be used across the body, but most commonly it's used in the face. Now with traditional peels, you often get immediate frosting. Sometimes it can be a bit stingy on the skin depending on what layer you're going into and what acid is being used. And once you've had the peel, over the coming few days and weeks, you will then have peeling, and that is the old dead skin coming off and fresh new skin coming through. So you have an element of downtime, and the downtime is more the deeper the peel. Peels need to be considerate of the type of patient that's in front of you, really taking into account the skin color. Now PRX-T33 is a revolutionary peel, and it's quite different to anything else, but you will see very traditional ingredients in there. So it's really quite interesting. So PRX is made, the main ingredient in there is trichloroacetic acid, so TCA. Now this people will associate with very deep peels, so peels that really penetrate right down to the lower layers of the epidermis and right into the dermal layer of your skin, and will cause a lot of downtime, a lot of frosting on the skin immediately, so that's all that white color that comes onto the skin, and then lots of peeling after. But the way it's been used in the PRX peel is very different and doesn't cause any of that, but you still get all the benefits. So the TCA in this peel has been combined with some hydrogen peroxide, and this is the perfect combination to allow the TCA to penetrate down to the dermal layer of the skin and bypass the epidermal layer. So then you don't get that frosting, that peeling, that sensitivity of the skin immediately after, and you can actually go about your daily activities immediately after. You'll see me having it done in a moment, and I've had it done numerous times, and it's not something that I'm worried about at all. So it penetrates down into the dermal layer, and it will stimulate lots and lots of collagen, elastin, hyaluronic acid. It will really tighten the skin, shrink the pore size. It will also, because it's in that superficial dermal layer, it can then touch all the melanocytes or pigment cells and then really target those as well to reduce the amount of melanin that they're producing if they're overproducing it. So in cases like hyperpigmentation or melasma patients. The other amazing thing about this peel is that you apply it in layers. So during the treatment, you're applying it in multiple different layers onto the skin. And because you're doing this, you're getting this instant firming and lifting effect of the skin as well, which is honestly just amazing, because then you can go out that evening, you can even put makeup on 5 to 6 hours afterwards, and it just gives that really nice glow immediately, but also this lifting effect. So other ingredients that are in this peel are kojic acid. Now kojic acid is an amazing acid that's used in multiple different types of skincare, but in the peel is 5%, and it works primarily to help reduce the amount of pigmentation on the skin. Now the key thing to note about the PRX peel is that it's using ingredients that are traditionally used for aggressive, deep peels, but you're not getting any of that in this. It actually feels like lighter than a superficial peel. So you've got your TCA, you've got your kojic acid, hydrogen peroxide. All of these things are going to cause incredible stuff on your skin, like collagen production, elastin production, hyaluronic acid, reduction in the pigmentation, reduction in fine lines, wrinkles, a lifting effect, a tightening of the skin. I mean, I could go on and on and on. It's just an incredible peel to have. So you're getting all of the strong ingredients, but without any of the side effects. So it's not an aggressive peel anymore at all. Right, now what happens on the day? Important things to note is for about a week before, you want to stop using any very strong actives on your skin, like retinol, tretinoin, any retinoids or vitamin A products. Things like vitamin C or any other actives like that, just avoid using those for about 2 to 3 days before you have the peel. So on the day of the peel, you will come in, you'll be greeted by our staff, and then our therapist will take you through where she will go through the procedure with you. And it's a very quick, painless, pretty uneventful treatment, but you need to do it in a place that is medical, because this is a medical device, it's a medical treatment. So you'll have your skin cleansed with a simple, gentle cleanser a couple of times, because you want that skin to be completely crystal clear of anything on the skin, including SPFs, etc. So try and come in with basically nothing on your skin other than just a bit of your moisturizer and SPF, because that will make the cleansing process much easier and more effective for you. You'll then have the PRX peel placed on your face, and you'll have a few layers, and each of these layers will be massaged in a very particular type of way and thoroughly by your therapist. This allows for the product to really penetrate and for all the lymphatics and everything in your skin, the blood supply, to really get involved to get the maximum effect from that peel. So then straight after the peel, you might have a little bit of redness, but nothing more than that. You certainly shouldn't have any stinging or burning sensations like you can have with traditional peels. You don't get that with this one. And we will apply a bit of SPF and moisturizer on afterwards, and then that's it. You can get on with your day. Just don't apply any makeup on your skin for the first 4 to 5 hours, and avoid any actives on your skin for a further 1 week. So that includes things like retinoids, so retinol, tretinoin, vitamin C serums, niacinamide, and certainly no acids on your skin. So that includes all AHAs, BHAs, like your salicylic acid, or your AHAs like lactic acid, glycolic acid. Just avoid any acids on your skin for at least a week afterwards as well. It's best to have a course of these peels, so anywhere between 2 and 3 peels is ideal, and you should leave about 4 to 6 weeks apart between the peels. Thank you so much for watching. If you have any questions about the peel, then please drop us a comment down below, and we look forward to hearing from you.